I'm Dr. Raghavendra Babu. I'm the Senior Consultant and Director of Institute of Hepatobiliary Sciences and Gastroenterology at Cytecare Cancer Hospital. It's a well-known fact that a smaller incision leads to less trauma and it leads to better recovery and better outcomes. So, in developing this, I think minimally invasive surgery has been at the forefront of this. We use very small incisions to do advanced surgeries, and that has been growing every day, every single day. And the next addition to it is robotic surgery. There is obviously a limitation of laparoscopic surgery, where you can't do every surgery laparoscopically, and robotic surgery helps us in overcoming this limitation. Over the last 10 years, there have been various generations of robotics which have come into place. Now it is already at 5th generation of robotics, and now with this robotics in surgery, we can do advanced cancer surgeries like the surgery of rectum, surgery of liver, surgery of pancreas. These were surgeries which we used to do using big incisions, and it used to lead on to long stay in the hospital, 15-day stay in the hospital, and it used to be the recovery used to take very long. It used to be 2 months of recovery after surgery. But now, using these minimally invasive robotic techniques, we can send the patient home within 2 days, and patient will be back to work within a week. And this also leads on to taking systemic therapy quite early, so that if it's a cancer, you can go on to your systemic therapy like chemotherapy very early. So overall outcomes and overall curing of cancer is better. And also recently, there's been a lot of AI, artificial intelligence into robotics, which has led on to even advanced surgery being done without much complications. I'll give you an example. The scans of the patient who comes to us will be fed into the robotics, and when we are operating, we can superimpose the images of the scan onto the real organs in an augmented reality, and that leads on to we can see where the tumor is exactly, and we can cut away from the tumor. So it leads on to better cancer surgery. We can also see where the important blood vessels, where the important structures run, and we can save those structures, and leads on to decreased complications. So robotics is coming in a big way. It's coming in a big way, and it's helping us decrease the complication. It is helping us improving the outcomes of surgery. It is helping us patients recover faster and go back to their work faster. In Cytecare Cancer Hospitals, we have launched a special GI clinics. So there are 5 clinics which we have launched. One is a liver clinic, a pancreas clinic, a bowel and stomach care clinic, an obesity and weight loss clinic. We have also launched a gastritis clinic. So there are 5 clinics on 5 days of the week. The importance of this clinics is this covers the entire spectrum of gastrointestinal diseases, and we have also designed specific tests to help in diagnosis of any of these diseases. And the difference here, I mean, a lot of clinics are there. The difference here in Cytecare Cancer Hospitals is that it's a team approach. You can go to a medical gastroenterologist or a surgical gastroenterologist. They treat you as if you go to a medical gastroenterologist, they only see the medical part of it. A surgical gastroenterologist only sees the surgical part of it. Here we deal it with as a team approach, where we sit together and we decide based on your symptoms and your results of your test what is the best treatment for you. The best treatment might be medical treatment, where a medical gastroenterologist or a hepatologist takes over. The best treatment may be surgical treatment, where the surgeons take over. The best treatment may be dietitian, nutrition related, maybe physiotherapy related. All of these people will be acting as a team to give the best possible treatment for you when you approach these clinics. So that is the major difference here. The difference is the treatment is evidence based, and it depends and medical treatment or surgical treatment can be given depending on what is the best thing for you.